Number 10, catheter care. In this skill, our supplies are going to be 2 towels, 2 washcloths, a chuck, soap, and a basin. The pass or fail for this skill is making sure you check the catheter tubing from the body to the bag to make sure there are no kinks or tangles before you perform any of this skill. Knock, knock. Hi, Miss Susie. How are you doing today? My name's Michelle. I'm your CNA. I am here to clean your catheter. Is this a good time? She says yes. Here's your call light. Shut the curtain. Wash my hands. I'm going to come over here, and the first thing I want to put on are my gloves. I'll grab 2 towels, a chuck, and 2 washcloths. Gonna open my barrier towel, setting my supplies down. Miss Susie, can I go in your drawer and get my supplies? She says, sure. I grab a basin and soap. I'm gonna go ahead and check the catheter tubing from the body all the way to the bag. It's free and clear of any tangles. So I'm gonna go ahead and place my chuck under Miss Susie. Miss Susie, go ahead and lean away for me. Okay, lean towards me. Great. Here's your call light. I'll be right back. I'm gonna go ahead and get your water. Next, I want to go to the bathroom and get 3 inches of warm water. At state testing, they will check your water to make sure it's warm. So if you feel it getting cooler, you may want to get more warmer water. I get the 3 inches of warm water. I test it. Miss Susie tests it. And at testing, your examiner will actually test it for the Miss Susie. Go ahead and place this down. Put my 2 rags in the basin. Move Miss Susie's gown up and put our drying towel over her abdomen. I'm going to go ahead, take my washcloth, and I'm going to make what I call a taco. I'm going to fold it in half. So I have 4 areas to clean with. We pull one forward, clean with this area, pull it back, and use the next. So the first thing I'm going to do is clean down the middle, which is called the meatus, with soap. Second piece, down the labia, inside and outside of the labia. The other labia, inside and outside. And then the 4th piece, I'm going to hold the base of the tube and go down 6 inches. I'll place this on the side of the basin so it doesn't get my water too soapy. Take this washcloth, wring it out. Make my taco. And I want to rinse the same way I washed. Rinse down the middle. Rinse down the side. Rinse down the other side. And then rinse down the tubing. All right, Miss Susie, let me go ahead and pat you dry. So we're going to pat dry using different areas of our towel. And then, again, make sure the tubing is dry. Okay, Miss Susie, I'm going to remove this chuck. And as you know, we always remove a dirty chuck by rolling it away from us. So I'm rolling that away. Lean towards me, please. Roll this away. Okay, let's cover her up and give her her call light. This chuck is going to go ahead and go in the garbage. We're going to place our soap back in our middle drawer. And all of our extra towels here are going to go in the wet hamper. I'm going to put my table back. And I'm going to dump this in the toilet because it is from the waist down. I come in the restroom. Turn the sink on. Lift the toilet seat and lid. And dump the contents. We'll rinse, dump, rinse, dump, rinse, dump, Pat it dry with a paper towel, spray it with disinfectant, and set it down. Close the toilet lid and seat. Flush. Remove our